Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
This is KRWG Public Media, TV, radio, online. News that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Thank you for joining us on this edition of Newsmakers. I'm Madison Staten. Doña County reports that approximately 71% of current inmates at the county detention center receive some form of mental health treatment. I visited the detention center to discover what that treatment looks like. Within a remodeled block of the Doña County Detention Center, Jason Duran and his team of mental health specialists are working to serve the 71% of inmates in need of care.
Many of our patients haven't received any care until they come here with us. That is why it's our mission to continue to provide the same level of care that anyone would receive.
45% of the individuals under the care of Duran's team of 9 rely on a combination of medication and counseling. According to Horizon Health, the organization contracted through the county to provide mental health care. No individual is receiving medication for mental health needs without some form of counseling. The high number of individuals in need of mental health care while incarcerated is a trend seen across the United States. According to a U.S. Department of Justice report, 44% of jail inmates had some type of previously diagnosed mental health disorder, higher than the 37% seen in state and federal prisons. Horizon Health CEO Sarah Tershwell says the most challenging part of treating individuals within systems like the Doña County Detention Center is that their mental health needs have largely been ignored prior to incarceration.
Why has a county jail in New Mexico become basically a de facto mental hospital? Why? Because we at some point decided that we were not going to provide a safety net for people and give them the mental health treatment that they need.
Duran says his team sees a lot of previous patients return to the detention center, despite efforts to connect individuals with resources. Micah Pearson, the executive director of the Southern New Mexico branch of the National Alliance on Mental Illness, is working with Doña County to find solutions. In a longer conversation about mental health, Pearson told KRWG NAMI Southern New Mexico is in the last stages of negotiation to provide peer navigation services.
My favorite program that we are working with the county to implement, which is peer navigation services, which are independent from any particular behavioral health provider, a team of folks who will go meet a client where they're at and figure out do a needs assessment. We watch this person, we make sure they get from point A to point B, we see everything that's happening.
While there aren't enough resources at the county level to fund Pearson's entire proposal, he says the next step is looking for other funding sources.
Everybody says we need a thing, but nobody wants to pay for it. The county actually really does want to pay for it. They just don't have those funds. But that's the thing. Everybody says it's important. Nobody really wants to put their name on the checkbook. And partly because that requires rethinking the system. And in some cases, you are taking money out of some budgets to put it into another.
Pearson notes that the city of Las Cruces could be one potential funding source, but that conversations still need to occur. And NAMI Southern New Mexico isn't the only entity working to enact change. Horizon Health says they are advocating this year to expand their Release with Care initiative nationwide, including expanding services offered in Doña County.
What that initiative does is for addicted individuals, we give them 5 days, a 5-day supply of medication. Because when somebody leaves, they're not necessarily going to figure out everything that they need to figure out by the time they actually need that medication.
Above all, those like Jason Duran, who work at the Doña County Detention Center, want the community to understand that while big change is needed to provide better mental health treatment nationwide, it's the small victories that mean the most to staff.
What drives me is knowing that the work that we do within the detention center does help to improve lives And it helps to improve those individuals that our other folks might forget about. When we have our small victories, it means a lot, because little small victories over time add up to huge accomplishments.
To talk more about mental health services within Doña County, we are joined by Crisis Triage Center Director, Karina Diaz. Welcome to the program.
Thank you. Thank you for having me.
Well, I'm excited for our conversation today. So just to get started, for those unfamiliar with the Crisis Triage Center, what services do you offer the community?
Yes, the Crisis Triage Center is a center that was built for the purpose of providing quality crisis care to anyone in the Doña community, county. This is crisis care for mental health, emotional distress, substance use, anyone, anytime over the age of 18. We're open 24 hours a day, 7 days a week, 365 days a year. We have medical services, so a nurse is on site in every shift. A clinician, a licensed practitioner, is on site in every shift. We have peer support workers, so people with lived experience who have been through some of the issues that some of our clients or guests have been able to have or are going through, and have or can provide a lending hand and a listening ear to help them through and stabilize the crisis. We provide assessment services. This is a psychosocial center, we call it the living room. It is more of a comfortable setting for someone who's experiencing emotional distress to come in and sit down, have a meal, shower, have a place to lay down and rest and engage in activities to relieve some of that emotional pressure that they might be feeling, and receive assessment, a nursing assessment, psychosocial assessment, psychiatric assessment if needed, and being able to be connected, which is one of the most important two services in the community to continue their recovery.
So who can utilize the center services? Do you need a referral from a doctor, or can you just walk right in?
You can walk right in. There is no referral needed at any point, and it's anyone over the age of 18.
Mm-hmm. Wonderful. So how has the center grown since first opening in mid-2021?
Yes, we opened June 21st, 2021, and it's growing. It's steadily receiving more of a census of guests visiting our center. We actually have around 215 enrollments to date. So we can call it admissions or enrollments, but people who have visited us and have utilized our services. We're still in the initial months, so we've been open around 7 months. This interview is amazing because I think the more that we can teach and educate the public on how to use this service, the better it is for everyone. Mm-hmm.
So during a recent Las Cruces City Council meeting, Cassandra Gondra of District 1 spoke about her concern that the center isn't being utilized to capacity. Do you have similar concerns?
Our capacity is 12 at any given point. We would love to see more people utilize the center for sure. I mean, the need is there. The need is there in the community. And anyone can utilize it. You or I can utilize the center instead of going to an emergency room, right? And instead of utilizing emergency services, which at this point has been the primary way to access crisis care for anyone. I mean, the emergency rooms are flooded with people who have significant stress, who are experiencing panic attacks, who are experiencing suicidal ideation, or intent to harm or have harmed themselves. This is a more appropriate resource for everyone who needs a lending hand, who needs to be assessed and evaluated and be able to be connected to services.
So what do you think is the best way to actually expand those current numbers? What, as director, would you say is the path going forward to get the word out?
I think interviews such as this one, the more we talk about it in the media, the more we talk about it, not only in outreach, we currently do a lot of outreach and continue to have meetings with providers in the community, to teach them about our resources and how we can collaborate, to continue to do that with hospitals in the community, to continue to do that with Las Cruces Police Department, with any entity who touches any one person at any given time that is in need of crisis care. The more public information we put out there, the better it is for everyone.
So what would you identify as the top operational concerns just from June going forward to today?
That would be it. Getting the word out, making sure that the public is educated. Yesterday, we had a few referrals from actually some of the staff members who were, of course, telling people about us. And someone's mother heard or was talking to one of our staff members and realized that their son, young adult, would be appropriate for our services. So the more I think that's majority of our referrals have been people from the community who have heard and realized that someone in their family or a loved one would be needing a resource like this. So that's the operational concern, is being able to get the word out there, continue to provide public information for folks. And also, I would say that one of these services are completely free for everyone. If you have insurance, we're able to bill the insurance, of course. But one of the interesting facts is that Medicare and public insurance do not cover crisis services, which means that we are in the counties continuing to advocate for parity, right? So that everyone can have access to crisis care.
So are there specific mental health trends that you're seeing within the county that our viewers should be aware of?
Suicidal ideation. There's a lot of people who are under severe stress. We can say that a lot of it is COVID, working in a pandemic or living in a pandemic, so isolated from a lot of the very important social connections that we had prior to COVID are definitely a factor. But even before then, that was an issue as well. There's lots of, sadly, drug use in our communities and not enough services that are, when I say quality services, I mean services that are appropriate to someone who is going through a crisis and might not even realize that they're going through a crisis. A lot of people that we see have come to the center quite a few times and definitely need the resources. Will probably utilize the resources a few more times until they're able to see that there is a need to recover or that they can start that recovery process. Right? So when I say it's anytime, anywhere, no matter who you are, that you can access care and not have to go through a medical clearance, not have to be sent out for a COVID test so that you can come into our center, right? We're decreasing the barriers that exist for everyone in the community to be able to receive services.
So if an individual would like to take advantage of your resources but isn't sure where to start, what would be your advice to them?
I mean, they can definitely call us or just walk in and ask the questions. If sometimes walking in could be pretty intimidating, you can always call, reach out to us. We're open 24/7. Yes, I think that would be the most appropriate.
How does the center follow up with individuals after that initial first visit?
Yes, so we are able to provide crisis care for 23 hours. After that, we have to connect people to resources, of course, if whatever the resource that is needed or the next level of care that is appropriate for that individual. We do provide follow-up calls after 72 hours. We will reach out to providers who are involved with the individual. We'll reach out to whoever we have permission to speak to on behalf of the individual to make sure that they were able to get connected to the next level of care. A lot of what we do during our 23 hours is connecting them in person, if at all possible, to provide a warm transfer to the next community provider or their family members.
Well, I know there was an incident last fall where a person being brought in by the county sheriff was turned away due to lack of staffing. Have any similar instances occurred since then?
Yes, that was a very unfortunate time. We were, of course, brand new, and that's not an excuse, but we definitely have seen a shortage of nursing. We have since then addressed that, and that has not happened again, thankfully.
So we're seeing national shortages of healthcare providers. How is that impacting the center?
Well, at this time, we've been pretty grateful to have a nursing manager who's been incredible in making sure that we're staffed continuously, and that we have layers established with a nursing agency as well as a staffing agency, as well as our own pool of nurses who we can be able to call upon if need be. We've definitely seen the stress that has caused for ourselves, as the example you mentioned. At this point, it's been a blessing to have someone who's managed it so well in-house. Mm-hmm.
So what is your current relationship with both city and county law enforcement today?
I'm sorry, can you repeat that?
Mm-hmm. What is your current relationship with both city and county law enforcement officers today?
Yes. Well, we continue to have monthly meetings, especially with Las Cruces Police Department. We have a stakeholders meeting that the county started last month, and we will continue to have that, I believe, quarterly, to be able to continue to work through issues, work through problems, work through the wrinkles, which in any new endeavor that's bound to happen. So we are continuing to augment our capacity to collaborate and coordinate.
So what protocols does law enforcement have to follow when they partner with the Crisis Triage Center?
Protocols. Well, we have meetings. Protocols, I don't know that I would call them so formally, but they are able to bring in anyone at any time to our, we have an actual first responders entrance. So as soon as an officer drops someone off, really and we track this, their stay at our center is like less than 3 minutes at this point. So all they have to say is, hi, I'm so-and-so, and this is so-and-so, and this is happening, and then I gotta go and go out into the community and do what you need to do. Mm-hmm.
So what additional mental health investments do you think should be priorities for both the county and the city?
Mental health investments? I think, well, one of the things, and we talked about this just recently, the elimination of copays for behavioral health services was intended to remove any fiscal barrier for anyone to be able to utilize the center. I think that what is still missing is the parity, the insurance parity. I think that is a very important part. The county continues to advocate for this. We need to be able to have parity in all insurances so that everyone can have access and that the barriers are lessened to be able to access healthcare.
So how would you like to see the center continue to grow in the next 5 years, 10 years even?
Oh my goodness, that everyone, the community is aware, that the county is aware that we exist, that we speak 2 languages on site, English and Spanish, that we're able to access language line, that anyone who's experiencing any stress has a place that they can go, feel comfortable, talk to someone, and be able to be connected to care in the community. That we're consistently, and not only in this state, nationally, talking, no matter where you are, about the lack of resources, especially in mental health, especially after this pandemic, and the likelihood of anxiety to have gone up, and mental health illness as a result. The likelihood is high that a lot of us need this care, this quality of care. So for people to know, for people to know that they can come and that it's free and that we're here for them.
So what would you identify as the key takeaway for our audience to understand about the center?
Yes. The key takeaways is that there's no shame in asking for help, that we are here to help, and that there will be no judgment whatsoever for anyone accessing care. That we, if you're over the age of 18, and even if you're under, if you come in with a parent, we'll be able to talk to you and connect you to the right services. But if you're able to come in, if you're able to call, we will do everything in our power to be able to connect you to where you need to go next, to be able to ensure that there's treatment waiting for you after us, and that there's hope. Whatever it is that you're going through today, that there's a light at the end of the tunnel, and that people have lived through what you've lived through and have recovered, and that there is no shame in asking for help.
Well, according to the National Alliance on Mental Health, as of 2020, 1 in 5 U.S. adults experienced some form of mental illness. When you hear a statistic like that, what goes through your mind?
Well, it's very sad, right, to hear those statistics. I have definitely, before I moved to Las Cruces, I lived in New York and have been in the mental health field for 20 years. And I have definitely seen firsthand how much, not only in this state and New York and other states, the lack of access to resources, how much that impacts folks. And the lack of education that exists on how to access care and what therapeutic services are, what behavioral health services are, how they can help you. The lack of resources or the lack of education or the lack of understanding around behavioral health, I think contributes to a lot of these cases where the people who are experiencing mental health illness get ostracized by a lot of our communities, by a lot of family members, right? It's shameful to talk about it. There's a lot of judgment around it. There's a lot of biases, even within providers around it, right? So it's a continuous effort on all of us, on providers, on law enforcement, on people from the community, in our own families, to be able to talk about openly if we're feeling sad or we're feeling anxious, that we're not kind of looked down upon or looked at with judgment, so that we're then feel a sense of belonging and are able to then ask for help.
And how have you seen the pandemic influence this over the last few years?
It's exacerbated a lot of the mental illnesses. It's exacerbated the symptoms in the mental illnesses. It's exacerbated the propensity for us to feel anxiety in our surroundings and to feel unsafe, to feel a consistent source of not knowing what's going to happen next. So uncertainty, which then we may or may not feel it, that we're going through it, but then there are certain interactions maybe with people or certain things that may have happened during the day, and then we feel the stress, or we may be overreacting around certain things that maybe in the past we wouldn't have. We've become more isolated. Our social interactions have lessened, right? So the relational support isn't there. So the COVID pandemic in and of itself, the fear of dying, the fear of someone you know dying or having known someone who died, the amount of grief that exists right now nationally and worldwide is definitely felt. So it's exacerbated a lot of the symptomatology of mental illness, sure.
So what specific additional steps would you like to see the state take to address this issue?
Yes, again, parity. We need for everyone to be able to access behavioral health services. A lot of times, and this is something I hear a lot, and not only in outside in the world, in the public, but with clients, but also with family members. A lot of times people do not access health care because it costs money, right? And you have to then see yourself make choices between paying rent or food and healthcare. I think that is the number one barrier for receiving mental health care.
Absolutely. So what would be your message to our viewers today on the topic of mental health?
My message is that we are here to help, that there are always people who are here to want to help someone who's going through a stressful time, That is the main message, that there is hope out here, that there is hope out there, that there is hope everywhere, that we can access services, and that we can call a 24-hour line and be able to get and receive that help.
And what personally drives you to work in this field day in and day out?
Because I've seen progress. I've seen people, I've been first row and center witness to people who have been in a stressful situation, who are experiencing suicidal ideation every day and feel hopeless and helpless. And then through services, through being able to go to therapy and receive the help that they need, they feel a sense of hope. They feel like they have new wind underneath their wings. They're able to form relationships that they feel proud about. They're able to hold essential jobs that they feel proud about, or practice things that they might not have thought about, and feel a sense of enriching in their lives, something that they hadn't felt before, and not have those suicidal ideations again, not have those, or if they do struggle with them, to know that there is always someone there who can help them through it, and that there is hope out there.
Thank you so much for joining us today. That's our time for now.
Thank you.
Of course, so join us this week on KRWG Radio. Every weekday, it's Morning Edition 5 to 9, Fresh Air at 11, followed by Here and Now, noon to 2, and All Things Considered 4 to 7. KRWG News is always online at krwg.org, and we'd love to hear from you. Email us with story ideas and video submissions. The address is feedback@nmsu.edu. For all of us at KRWG News, I'm Madison Staten. Have a great week. We'll see you next time on Newsmakers.